Hello, welcome to this NMC OSCE video. I wanted to do a quick video to highlight some of the key updates and changes that have come out from the NMC. So these are changes that are going to be implemented on the 9th of September. So I wanted to go through those with you so you've got the most up-to-date information. My name is Hannah. I am an experienced UK registered nurse, a university lecturer, and have been an NMC OSCE lead, and I provide private NMC OSCE tutoring and training. So firstly, I always tell my tutoring students to regularly go to the NMC website and check for any updates in relation to the exam, because it has gone out to a new provider, so there will be kind of updates coming through as well. And update that has come out is some changes. So if you go to the NMC website here, and go to this announcement here, it will tell you the key changes, and has also uploaded all the key supporting documents and marking criteria that have been changed. So I'm going to go through this with you now. So new updates and changes come. So they will take place from the 9th of September. So if you've got your OSCE exam booked before the 9th of September, you don't need to worry. Everything continues on the same existing versions and the same marking criteria and same station timings. If you are planning to book your exam after the 9th of September, then you need to prepare using these updated materials. If you think you're going to have a resit book, so you've taken your first or second attempt before the 9th of September, but your next attempt will be after the 9th of September, I would imagine you would stay on the existing versions, but I would just email your test centre just to confirm that you will remain on the existing versions and not go on to the new ones. That's my kind of advice for that. So what are the key changes? So some welcome changes, actually. So, as educators, we give a lot of feedback to the NMC, and some has been around timings of stations. So the MSU and U analysis has been increased to 12 minutes from 8 minutes. So that's a really welcome change, because the 8 minutes was incredibly difficult to do. I could only just get it done in 8 minutes. So that's great. So that should take some of the pressure off and allow that station to be completed without having to really rush through it. And the second station, which has been increased, is the fluid balance. That's the written station. These are for adult NMC OSCE, and that's been increased to 14 minutes from the 12 minutes. And again, that is really welcome change, because it gives you a little bit less more time, so you don't have to rush. And if you do make an error, it should give you that time to correct it. Because often, sometimes you make an error, you don't have time to finish it, change it, and then you get a refer on that station. So that is really good news that those two stations have increased in time. Now, when I was looking through the new marking criteria and station timings, I couldn't see any in-hospital resuscitation including that. So the in-hospital resuscitation for both adult and child, the basic life support, has been removed and not in the current marking criteria. It's not in the station timings. Now, there isn't an official notification in the NMC webpage about that being removed, but currently it's not in that marking criteria, so I can only assume that it has been removed. But I am most probably going to contact the test centres and just want to get that confirmed, really. It's obviously quite a big station to come out, but that is currently not in the new version from September the 9th. It's not in the station timings, and it's not in the updated marking criteria for adult or child. The other change is a change to the Aseptic Non Touch technique. So candidates are no longer asked to follow a clean hand, dirty technique, but you are expected to follow an Aseptic Non Touch technique, thinking about those key parts and key sites. And so that has been a change. They've also stated on the NMC website that where they've tried to reduce the use of PPE, gloves and apron for unless it is clinically indicated. And I have looked through all the marking criteria and all the skills, and I can't actually see much difference in terms of when PPE needs to be used and not used. It still looks very much similar. But just be aware of this change with your ANTT. And one of the key changes I noticed throughout the marking criteria was in relation to medication administration, and where it says before it would just say administers drugs due for administration correctly and safely, but now they've added in these 3 bullet points here. So administers the correct dose, checks the expiry date, and handles the medication correctly. And that goes for your implementation station, but for all your clinical skills which involve medication as well. Now, this isn't really a practice change, because definitely something that I would teach anyway as part of that procedure, and definitely something that was always expected, but they've just highlighted those 3 components in the marking criteria. So I assume it's a little bit clearer for candidates to know that that is expected. So you'll pick that up on the marking criteria change as well. So supporting documents, so for child students, they have updated the PEWS charts. So this now aligns with the national PEWS charts. And if you go to NHS England website, you'll see all 4 PEWS charts there for the 4 different ages, which previously the NMC were not using. They were only using 2 PEWS charts. So there's now 4 PEWS charts, so 1 for 0 to 11 months, 1 to 4 years, 1 to 5 to 12 years, and over 13 years. So definitely familiarise yourselves with all 4 charts. And it also will mean that your patient scenarios and child can obviously then range from 0 to greater than 13 years. So I'd go to the PEWS charts are in the NMC supporting document pack, or you can go to the NHS England website and get further information and download the separate copies of those there. As it's changed, so there's this one statement on the NMC webpage around the development of the exam, and they're really trying to actively discourage rote learning. And you'll know from my videos, I'm really against rote learning and memorization. You must understand the theory of what you're doing, and not just have copied and memorized some video that you've seen and not understand what you're doing. And so for those that are taking 2nd and 3rd attempts, you may be given a different scenario to test the failed skill at the resit. Now, there isn't any more information on there, but I think it's really important when you go out for any 2nd or 3rd attempt, and I always tell my nursing candidates this anyway, that you must read that scenario really carefully. So you may get a different type of scenario to test the same skill. So don't go up and assume you're going to have exactly the same as you had last time. So what are my top tips with this really? So always regularly go and visit the NMC OSCE webpage and check for updates. This is really important. You normally, like I go on the site at least once a week, and I always check the marking criteria. And right at the very bottom, it will say the version date. So the current version date says July 2024. The previous version date was December 2023. So always check that version date, okay? So you need to be going to the website, download yourself a new copy of the marking criteria. I would read this really carefully and check for any changes. I've had a look through this afternoon and identified, you know, the key big changes that I could see immediately on that, but go through and check through that. And just to make sure if you're doing any training, whether that's self-study, using the internet, or you're going to a training centre, make sure that they are using the most up-to-date resources. You're getting the most up-to-date version of the marking criteria. You're being taught the most up-to-date versions of those skills to the most up-to-date station timings as well. That's really important. I obviously need to adjust some of my YouTube videos now to change those timings, and I'm going to write a note on the bottom of those as well. So I hope that's helpful for you. And always, you know, try and keep yourself up to date as possible with the NMC exam, because changes do happen. And again, I'm available for support and tutoring if you want any help with your NMC OSCE exam, or if you're on a resit and want some support with that. I can do lots of different options with you, from 1 hour to a full training block session. I've also got my 4 new OSCE study books I'm really excited about, which I now need to go in and update a little bit as well, just to make sure those changes are reflected in those as well. And you can drop me an email at hannah.lames@outlook.com. Visit my social pages, Facebook and Instagram, so I'll be putting updates on there as well.